What we're going to do today is show you how a chiropractor assesses a patient. As chiropractors, we treat the cause, not the symptoms. And our goal is basically to identify the root cause of our patient's problems. In our center, we have a saying that goes like this: test, don't guess. We have a patient that presented with neck pain. Our goal was to identify the root cause of his neck pain, and this is how we went about doing it. Other than the standard analysis of taking a very good history and examining our patient, we also went a few steps further. Number one, we had our patient do an X-ray. Number two, we did a foot and gait analysis. Number three, we did a surface EMG to assess the muscles in his back. And number four, we did a range of motion assessment for our patient.
C3. C5. C7. C1.
What we're going to do is we're going to see how much your neck can move in the different ranges of motion. So the first thing I want you to do is bend your head nice and slowly forward as far as you can. If there's any pain, stop. Then come back to the middle and bend backwards as far as you can. I'll tell you when to start. Okay, start now. Backwards. Perfect. Back to the middle and just relax. Next exercise is where you're going to take your left ear and move it towards your left shoulder without lifting your shoulder up. Come back to the center and then move to the right hand side. Ready? Okay, go for it. That's perfect. Remember, if there's any pain, don't go further than that. Next one is where you're going to turn your head and look over your left shoulder. Come back to the middle, over your right shoulder. Ready? Okay, go for it. Right shoulder, back to the center, and just relax. Okay, Mr. Lee, I want you to walk as you would normally do. When I say go, go. Go. Okay, what I want you to do is lift up the front of your right foot as high as possible. Okay, put it down. Now the left foot as high as possible. Perfect. Now what I want you to do is lift up your right heel as high as possible. Put it down. And the left heel as high as possible. Okay, what I want you to do next is roll both of your feet outwards. Perfect. Roll them in. Not that easy. Back to the... Now what I want you to do is straighten your right leg. Straighten your leg. What I want you to do is smile for me. Perfect. Now I want you to turn towards your left hand side. That's great. Another big smile. Wonderful, all done. Okay, Mr. Lee, for you to understand your problem, first you need to understand that a normal spine has a curved shape. What's happening to your spine is that your spine is straightened out. So from being curved shape, your spine is more straight. This is just an illustration. So what we're going to do next is we're going to look at your x-ray. Okay, Mr. Lee, this is your actual x-ray. So what you can see is that your neck is very straight. We do a little measurement. We measure the distance between these two lines, and what we can see is that you get a measurement of 4 millimeters. Normal will be 12 millimeters, so you have at least 66% less curvature in your spine than what you should have. Second thing that I want to measure is how much your head is actually moved forward. Because you have to remember, when your neck straightens up, your head moves forward. So this is a measurement between these 2 points, and we get a value of 44 millimeters. This value should actually be 0. So our goal is going to be to change these 2 values. This needs to go from 4 millimeters to 12, and this one needs to go from 44 millimeters down to 0. This is your results for your surface EMG. This is a test that we did to assess the muscles in your neck and your back. From this test, we can see that your neck muscles is indeed very tight, as indicated by these red areas over here, and your left shoulder area is tight as well. All this yellow that you see actually indicates weakness. So you also have a certain amount of imbalance where the neck is very tight, but your core muscles in your mid and lower back is very weak. This is a posture analysis picture of yourself. And what we've done is basically taken certain landmarks on your body and calculated the angles related to those landmarks. We'll be using this to measure or monitor your progress, because as you know, we can't take x-ray of you all the time. Your next x-ray will take is at least 6 months to 1 year into the future. But in between, we'll be using this test to evaluate or reevaluate your progress. Okay, this results here is the results for what we call your range of motion. This means how much you can actually move your neck. So what you see here is 2 bars, right, in the bar graph. The white bar is the normal range of motion. That means how much movement you should have, or how much movement we all have. The red bar is your actual measurement. So what you can see in this case is that normal movement for bending your head forward is 50 degrees. What you have is 30 degrees. So you have a reduction in bending your head forward. This fits with your x-ray because, as you can remember, with your neck being straight and your head already move forward, you will automatically have less movement when you try to bend your head forward. Okay, Mr. Lee, this is the results of your foot or gait test. Remember, what we are trying to do is we're trying to find the root cause of your problem. From this test, we can see that your feet is rolling in or dropping down too much. Usually, this is a term referred to as excessive pronation, and this test just confirms that you do have excess pronation. After obtaining the results of all our tests and assessments, we were able to identify the root cause of the patient's problem. In this case, it turned out to be excessively pronated feet, which was highlighted in his foot scan. This contributed to a biomechanical chain reaction, which caused his cervical curve to reduce, which was observed on his x-ray. Let's work out a short-term and a long-term plan for our patients. In the short term, our goal was to relieve his initial symptoms of neck pain. But ultimately, the goal was to correct the underlying biomechanical problem to ensure a long-term resolution of his condition. The great thing about the test that we have done is that it allows us to re-evaluate our patient and monitor his progress, and ultimately to allow us to compare before and after results for our patient. I hope that you've enjoyed this explanation of how we assess our patients at our clinic, but more importantly, I hope that you can see how chiropractic works and what sets us apart from the rest.